My name's Kayla. I just found out that I have Pectus Excavatum this past January, and I've been researching it ever since. And I was slightly disappointed to find that there's not that many girls talking about it on YouTube or on the internet at all. And I was wondering why that was. It turns out 1 out of 500 to 1,000 people have Pectus excavatum, but only 1 out of 4 of those are female. So that means I had a 1 out of 2,000 to 4,000 chance of being born with Pectus excavatum, and so did other women and girls. So I wanted to do this video blog so I could help people to understand, this happens to anyone. And for people who are looking for Pectus, especially girls, and they want to see if what they have looks anything like what other people have. And I just think that would have helped me so much if I didn't have to go searching for everything, wondering, am I the only one that looks this weird, or are there other people like it? So I guess I should start with, what is Pectus excavatum? Well, Pectus excavatum is a deformity that causes your sternum to sink into your chest and causes your ribs to flare out, also called coastal flaring. I'm lifting my shirt up to show you. As you can see, my chest sinks in right there, and my ribs stick out, as you can see right there. And just so you know, I'm not sucking in to make it look like it's worse. This is me sucking in. So that's what it looks like. It usually starts to develop around puberty. That's when I started. I started experiencing pain about 5 years ago when I was in 7th grade. I had sharp pain whenever I coughed, sneezed, or hiccuped. I have danced for most of my life, taking dance classes every year, almost every year, since I was 8. And then around 7th grade, I started noticing that I would have to take more breaks more often than other girls. And I had never had to do that before. It was also getting a lot harder for me to breathe. It wasn't normal for a child of 12 to 13 to be gasping for air after 10 minutes of exercise. My friends would tease me, jokingly of course, about it, saying things like, "Oh, stop being such a baby," and stuff like that, whenever I would have to sit after walking for a bit. And it's not that big of a deal. I mean, I know that now, but as a child that young, to have her friends make fun of her, it makes you a little self-conscious. So I was actually really glad to find out that other people are going through what I am going through. So how I found out I had Pectus excavatum was because I had to get a chest x-ray for something completely unrelated, and it came back negative for that, but positive for Pectus excavatum, and neither me or my mom had ever heard of that before. So after a little research, we decided to go to a cardiologist, and I ended up getting a echocardiogram, which is a ultrasound of my heart to see how it works, which is fine. And then we went to talk to a surgeon, and he had a CT scan ordered for me, which is just like a big 3D x-ray of my chest. And it proved that I actually had a severe case of Pectus Excavatum. And that pretty much just means that my chest caves in enough that it affects my heart and my lungs and makes it so neither of them have enough room to work at their full potential. The way they decide how severe a case is by using a method called the Holler Index. And if you want to know exactly how that works and what math goes into it to figure it out, you can search that. I'm not going to go into that. But I can tell you a normal chest has a Holler Index of around 2. And a severe case of Pectus Excavatum is 3.5 or higher. And what you saw on me is actually a 4, a Holler Index of 4. And so now, after hearing that at the surgeon's office, my mom and I thought about it, and we decided that we would like to do surgery to see if we can fix the problem, which most likely will help with my breathing and my heart later on, after like a year or so after the surgery. And the surgery just so happens to be this Thursday. I'll be heading up for blood tests tomorrow, and then I'll go into surgery the day after and be in the hospital for about average of 5 days. We don't really know. It's just how other people have taken the surgery. I don't know who will see this, but I am planning to try to give updates on the way up there, the waiting time between my blood tests and at the hotel the night before, and then right before going into surgery if I can. And then hopefully maybe some really funny anesthesia video, and we'll see. Hopefully I'm entertaining. And then I'll just keep documenting how progress is going, how I'm feeling after a couple weeks, after months, and up until I have up until 3 years after the surgery. And hopefully everything goes perfectly and it's all that I could have ever asked for. I'll see you some other time. Goodbye.